My name is Anna, and I'm a molecular biologist by training from University of Copenhagen. And as Tor just told you, I was a PhD student. I worked with insulin sensitivity and capillarization with DDA, and I was also a DDA consultant at a project at DTU. I'm one of those people that liked academia, and then I didn't. I was in academia for a lot of years. I can't even remember how long, but I started out studying medicine in 2001. So you do the math. And then I kind of didn't see a future because there were so limited opportunities with for example, professorships and other routes in academia. So I wanted to go into the private sector. Even before I was done with my PhD, I started looking for jobs, I think 6 months before, just sending out applications to everything I could find that was remotely relevant to my field of specialty. So before I was done with my PhD, about 2 months before I was done, I got a job through an ad as a medical information specialist. So I'm going to kind of give you an idea of what the different titles entail, because I thought that was one of the biggest challenges being in academia and looking at the different job roles and trying to apply for something, because there are these like very fancy titles and you have no idea what that means, and the descriptions are very vague. So the medical information specialist was actually a role I got through a consultant firm. So I wasn't directly hired by the company, but I was working for a consulting firm for 6 months. And the medical information specialist, what that entailed was answering questions from medical doctors and patients and so on about products. I was in, the company I was in, MSD, was called MSD. That's a huge American corporation with, at the time, they had 70,000 employees all around the world. So you might know them as Merck, Sharp and Dohme. After the 6 months had passed, the supervisor of the group I was working in told me that there was a position open in her team as a senior medical services specialist. So that was kind of an internal recruitment. So I applied for the job without knowing anything about it, and I had no idea what I was supposed to do. So I started the work, and it's funny that they put senior on the title when you have no idea what you're going to do. But so I'm just saying, don't let the senior scare you away. Sometimes it doesn't mean that much. It's like it's a salary level, and not necessarily requirement that you have a lot of experience within that area. So. The medical service specialist was within medical review. I don't know if you know this, but there is a lot of regulations within pharma. A lot of rules when it comes to what you can say as a company, and you need clinical data to back your promotional material up. And also, there's a lot of restrictions as to how you can work with physicians. So during my 2.5 years, I actually was given a diploma education by MSD in marketing compliance on the side of my work. So that was a big benefit. And what I did was to look through all promotional material that came out in Denmark. I was a part of a Nordic silo organization. But I looked through it to look for medical accuracy. Sometimes marketing people are not only not educated properly within the medical field they're working in, and they're also sometimes very creative what they do with the data. So I was kind of a filter to make sure that what we said was medically accurate, but also to make sure that the company was following the regulations in pharma, which otherwise can cost the company fines up to 500,000 kroners if you do something you're not supposed to. So after 3 years in MSD, I was looking for something else. The huge American corporation environment is not my cup of tea. So I thought it was too big and it was too sales oriented, and I was too far away from what I'd studied during my PhD. So I started looking at other opportunities, and I found an ad for sorry, the titles are very long, the clinical and post-market surveillance specialist. So I responded to the clinical, and I read the ad, and it was for a medical device company called Ferrosane. So pharma and medical device are two different worlds, but you can switch between them. So for this job, I kind of moved a bit further away from marketing and more towards or back to clinical research, because I was responsible for ensuring that we had the clinical documentation that we needed to kind of back up our products. Ferrosane medical devices do gelatin products, hemostatic products that you use in primarily neurosurgery. And the post-market surveillance part was entailed kind of supervising the product, or kind of not supervising, surveilling the product and looking for side effects that were reported for our products and also similar products on the market, to kind of make sure that the product performed as intended and also that it's safe for the patients. This was a pretty big role. It was actually enough work for at least 2 people, so the workload was pretty heavy. And the company was growing. It was a small Danish company with about 200 employees, so it was a drastic difference from the huge American company. But that was kind of what I was looking for. I wanted a change to see where I kind of fit in the market. So I'd been there for a year and 3 months, and then I was contacted on LinkedIn. I had a similar experience to the girl that was sitting down there. Yeah, that was you. Okay. Sorry. Them not telling me what company it was concerning, and not that much information. I had gotten contacted by recruiters before on LinkedIn, and I didn't have that much good experience. It was very vague, and it was sometimes for positions where I absolutely could not see myself, and I couldn't understand why they were contacting me based on my LinkedIn profile. So, but this time, the recruiting firm that was based in the UK was she was very pleasant to talk to, and it felt serious. And when I talked to her on the phone, she told me that it was Ambu she was recruiting for. And Ambu is, I don't know if you know it, but it's a Danish endoscope, single-use endoscope company that's situated in Ballerup, which I've been following for quite some time. They've had a fantastic success during Corona because they work with bronchoscopes and single use. So a lot of like reprocessing, cleaning of endoscopes has been abandoned in favor of single use because of the coronavirus being cross-contaminating patients. So the fact that it was Ambu just made me very interested in this job. And my current manager at Ferguson had worked in Ambu years ago in the same position I was being offered. And I also looked up my future manager's name, and I saw on LinkedIn that I had a colleague, friend of a friend that had worked with my current manager before in Coloplast. So I rang her up and I asked her what her impression of that man was as a manager, and she said he was the best manager she'd ever had. So that was kind of my impression when I got into the interview. So, jeg vil pile mig, tror jeg var. Okay, so this was the company that contacted me, FMC, which is a global talent recruiting firm. You can find them on LinkedIn. And I've already talked to Charlotte Ashton about me presenting her today, so she's expecting someone to reach out. So it started out with me having an interview with the FMC just over the telephone, and she helped me book interviews with my manager, which I had one telephone interview and one on the spot physical interview. So the first one was kind of weird with 3 people there online. You hadn't met anyone before, but because of Corona, we couldn't do it any other way. So, and that led to 2 tests. So one personality test and one IQ test. And then I was presented with a problem that I was supposed to solve and present at Ambu when I got there. So I was actually being interviewed with both the manager I have today, but also the manager for the other department in the global clinical research department that I'm hired in now. And I was actually offered a job under both managers. So that was pretty cool. So the salary negotiations went through FMC. I was more pushy when it came to salary than I was at my first job. Of course, you get more experience and you have more leverage, and you can push a bit more with the salary. So, but what has been fantastic with this forløb, help me, course, yeah, has been that the communication with this particular recruiting firm has been excellent. She's called me on multiple occasions after I got the job to kind of follow up and see that the match was a good one and that I was happy with the job. And that to me is something that signals that they're serious and they want to learn from their matchups. So, yeah. And just to, I know where I am, clockwise, 2 minutes, okay, good. So just to promote Ambu, we're actually looking for 3 clinicians right now. So please feel free to go into Ambu's LinkedIn. The jobs are presented there. So the clinical research specialist, that's my position. Don't bother with reading the senior, it doesn't matter, just apply. The clinical, so I'm a clinical research specialist for pre-market. So I'm a part of the innovation process and developing new products. The other one, clinical research specialist for post-market clinical development, is the kind of the maintenance, the clinical work around the products that have been put on market already. The usability specialist is more focused to the innovation products, but it's like what is the interaction between the product and the user? How can we make that better? So it's also something about ergonomics and so on. So yeah. So please go in and look at the LinkedIn profile for Ambu.
Thank you.